print out the PDF to take notes on before class. Of course, it's already class now, so hopefully you did that if you need it. So this is Patho today. This is one of my favorite Patho classes. I love this one because it's going to be interactive. We're going to be working some little problems today and learning how to figure out acid-base imbalances. But not just problems. That's important that we know how to figure out what type of imbalance our patient has, but also what causes it, because as nurses we need to know what causes something so we can know how to prevent it or participate in the treatment of it. So Patho, so big day today. You had your skills test, now Patho, and then y'all remember we have medication lecture this afternoon in skills. So please plan to return for that. It's a 2-hour day this afternoon, and it's really a hugely important class because you have to make an 80 on that exam related to that material. And so we'll give you some really good note-taking information this afternoon. All right, so anybody have questions on that? Are we wearing y'all out? Yeah. Okay. I know. Okay, so acid-base balance. We're going to talk about that today. And what is that? Well, our body, as part of our body processes, we're always making acids. And our body has to constantly be neutralizing those acids. Sometimes we're a little bit too basic, which is another word for basic is alkalotic. And so we have a system in our body that is constantly helping us maintain our acid-base balance. And you're like, well, why does that matter? Just not okay.
It does.
Let's try this other one.
You want me to text Caleb for batteries?
Let me see how this one works.
Okay.
Is this one the crunchy one? This might be the kind of crunchy one. We'll see. All right. So why does it matter if our acids and bases in our body are in balance? That's the first thing we need to think about today. Does anybody know why? Possibly. Well, the end result of knowing whether we're in balance is certainly the pH of our, what we're going to be talking about today is our arterial blood. But this is why it's so important. If our acids and bases get out of whack, our cells don't function like they're supposed to. We can have fluid imbalances, pretty significant electrolyte imbalances. Our enzymes in our body don't work like they should. And so we have to correct that quickly. And our body has mechanisms naturally for correcting that, but our body won't function like it should if we don't have our pH that you mentioned within normal limits. And we'll be talking about what normal limits are. So it doesn't sound like that big of a deal, but it's a huge deal because your body will not function like it should if you don't have your acids and bases balanced. I do recommend for this class, as you study, that I have concept maps posted, and there are only 5 of them for this lecture. There's one that talks about normal, what happens in normal situations, and then the 4 acid-base imbalances. It's a great way to study for this particular class. And the respiratory concept maps are good too. So here are some terms that we need to understand. We need to get straight right off the bat, okay? So we talked about pH. Somebody mentioned pH. That tells us how acidic or how basic or alkalotic our, in this case, arterial blood, but you can check pH in venous blood in your cells and everything else. But we're concerned about our arterial blood here. So that's really important. So you'll hear me use basic and alkalotic in the same interchangeably because they're pretty much the same. So what does pH reflect? Well, you can see here pH, you see that giant H there? It tells you about the hydrogen ion concentration in your blood. Hydrogen ion concentration. Okay? So here's what to me sounds kind of backwards, but it's just what it is. If you have lots and lots of hydrogen, too much, your pH is going to be low. So get that straight, because if you don't have that straight, you'll miss questions, right? So lots of hydrogen ions, that is acid. Hydrogen is acidic. Lots of hydrogen ions will make your blood acidic and your pH low. Kind of seems not right, doesn't it? Not enough hydrogen ions means that you're too basic or alkalotic and your pH will be elevated. So make sure you get that straight. So you're going to have scratch paper for the exam next week. So when I get it, I might just write that down. Low pH, acidic, lots of hydrogen ions, higher pH, alkalosis or alkalotic, not enough hydrogen ions. Got that part already? So what are hydrogen ions? Are they going to make you more acidic or alkalotic? Yes. Okay. Good. So make sure you keep that straight. All right. So normal pH, and we'll get to that when we start to figure out problems, but just so you know, normal pH, and you'll have to know this value for sure, is 7.35 to 7.45. Ooh, that's a narrow range, isn't it? 7.35 is the narrowest of all the ions. That's a narrow range, 7.35 to 7.45. So let me ask you this. If your pH is 7.3, are you acidic or alkalotic? Very good. A lot of hydrogen ions, not many. If you're 7.3. A lot. Very good. Okay. And so I'll probably repeat myself 10,000 times on that just so you can think about it, okay? So a lower pH, you're going to be acidic, or another word is acidotic or acidosis. Okay, so like I said earlier before we even got started, your body's part of your cellular metabolism is you make acids. And there are types of acids we make. Carbonic acids and metabolic acids. Carbonic acid, what does that make you think about? Carbonic. Like CO2, carbon dioxide, okay? CO2. Who do you think is going to be responsible for getting rid of excess CO2 that we have in our body? What body system do you think? Yep, keep that in mind. We'll be talking about that today. And then we make metabolic acids also, like lactic acid. Or y'all haven't talked about diabetes yet, but you know, if somebody's in DKA or diabetic ketoacidosis, that would be a type of metabolic acid. And so our body has to get rid of those type of acids too, okay? And so we're going to talk about how our body does that right now. Okay, we've got 3 mechanisms for helping us maintain our acid-base homeostasis to keep us from having all those bad things that I talked about earlier, okay? So our first line of defense are buffers. Buffers. They're working right now in you. They help us have really an immediate, almost immediate adjustment in our acid-base balance. What is a buffer? A buffer in this situation is a system, and it has all our buffer systems have a weak acid and a weak base. They have an acid and a base. And we'll talk about, when I do the next slide about buffers, how they work. And then our second line of defense is our respiratory system, or our lungs. And then our third line of defense are our kidneys, or we'll call that our metabolic system. Okay? So when we look at our blood gases in a little bit, how we know that our lungs are doing their job, and you know what their job is, right? To get rid of what? Yeah, CO2 or carbonic acid, which is CO2 in water. Y'all, that is the only, y'all say the only, that is the only type of acid that our lungs can get rid of. The only is carbonic acid. Why? Because it's a volatile, it's a gas. So, who's gassy? What a dumb thing to say, because you might be gassy because you ate too many beans, I don't know. But your lungs get rid of CO2, or that gas, okay? And how we know that they're working is we look at the PaCO2, which is the arterial concentration of CO2. And we're going to get to that in a little bit. It may not make a lot of sense right now. And then our kidneys, so we said that we're buffered by a weak acid and a weak base, okay? So our CO2 is an acid, and bicarbonate, that HCO3 you see there, is a base. And we measure that HCO3, we measure that to see how well our kidneys are working, or our metabolic system. So let's just think practically here. If I'm too alkalotic, which is what? Not enough hydrogen ions, or too many? Not enough. What do I need more of? Acid. And if I don't have enough, if I'm too acidic, I need more what? Base, because it's like a teeter-totter, you know? So that's what our body is constantly trying to do, is making sure that we are within that very tight frame of what? What's normal pH? Mm-hmm. And what are we measuring that pH in? Arterial blood. Okay, good. Okay, so the buffers are our first line of defense. Now, I would say that types over there, don't spend your time learning all that, okay? Today we're going to be talking about this carbonic acid bicarbonate buffer system, but you have other buffer systems in your body within red blood cells trying to maintain the acid-base balance there. You have proteins and all kind of other things that are constantly working to maintain that acid-base balance. But this bicarbonate carbonic acid buffer system is hugely important in our body. So what did we say bicarbonate was? A base. And CO2 is an acid, or carbonic acid, which is CO2 in water. So those are balanced. And you can think about those kind of like a sponge. Think about a buffer system as a sponge. And I have too many hydrogen ions. That sponge is going to suck them up and neutralize them. Or if I don't have enough hydrogen ions, what can we do with a sponge? We can squeeze it out to give us more hydrogen ions, okay? So constantly working back and forth. The perfect ratio to give us that pH of 7.35 to 7.45 is 20 bicarbonate ions to 1 carbonic acid molecule, or CO2 molecule. 20 to 1 is the perfect ratio. So does that make sense? This is a system of a weak acid and a weak base. We need more acid. We're going to get it, okay? We need more base. If we're too acidic, we're going to need more base. If we're too alkalotic, we need more acid. Does that make sense? Does it? Okay. Okay, that's our first line of defense, buffers. They're immediate. They're working all the time. Now, we got to get this principle straight, because in a minute we're going to talk about respiratory disorders. What we're about to talk about now is normal. What happens normally that our lungs do when they're healthy and they're doing their job. So what kind of acid did I say that our lungs could get rid of? What other kind? None. Okay. And what is carbonic acid? It's CO2 and water. Okay, carbon dioxide. Okay, so I got on there the next slide how they do it. But there's two things your lungs can do. They can breathe fast. Breathe out and breathe in. They can breathe fast or breathe slow. And that's what we're going to be talking about, how they help us maintain this balance. And again, we measure that with the PaCO2 when we look at our blood gas problem. Is everybody following so far? PaCO2 is telling us how much carbon dioxide we have. Yes. Now, carbon dioxide is an acid. Okay, it's an acid. So here's how the lungs do it. They adjust the rate and depth of respiration. And why? Because your body is always monitoring. If there's a change in CO2, if there's a change in pH, if there's a change in your oxygen levels, then the homeostatic properties in your body kick in, like your brain says, hey lungs, I see that the CO2 is elevated. That means too much, right? So what do you think those lungs need to do to blow it off or get rid of it? Breathe faster. Breathe fast. When you breathe faster and deeper, your lungs are getting rid of that excess carbon dioxide, which is what? An acid or a base? An acid. Okay? So breathing fast or hyperventilating blows off CO2, okay? Just get that principle down, because a lot of people get confused about the job of the lungs. So too much CO2, you're going to breathe faster and deeper to try to get rid of it. Now this normal mechanism here, this is normal, is only effective if you have healthy lungs. Okay, yeah. Well, I'm getting to that. Very good, because I said this is only effective if you have healthy lungs, okay, that can do what they're supposed to do. Hypoventilating, you need more CO2, which is an acid, right? So if I breathe slower, I'm going to be holding on to CO2 or keeping it, okay? And that can help me elevate those CO2 levels. So what are the lungs doing? They're either getting rid of excess CO2 or they're holding on to it when I need it. This is a normal thing that happens. All right? I have too much CO2 in my body, which means that am I too acidic or basic? Acidic. CO2 is an acid. So what are my lungs going to do to help me out in a normal situation? Hyperventilate, breathe faster and deeper. And what am I doing? Blowing off excess CO2. Very good. Okay. I don't have enough CO2. I need some more acid. What are my lungs? My brain's going to tell my lungs to do what? To slow down and hold on to CO2. That's all your lungs can do, y'all. Breathe faster and deeper or breathe slower. Okay? That's their job. That's our second line of defense. They regulate that PaCO2 or that carbonic acid, okay? That's the lungs duty. The kidneys. That's what we call the metabolic system. And y'all, I don't care how old I am, I still love Hello Kitty so much. So I found that and I love it. Okay, so the kidneys cannot get rid of carbonic acid, can they? They get rid of all the other kind of acids. They can get rid of lactic acid, acids produced from too much ketone, okay? Any kind of other acid the kidneys get rid of or neutralize. Now, the kidneys are a lot more complex than the lungs. The lungs can do two things. What were they? Hyperventilate, hypoventilate. What kind of gas can they get rid of? Carbon dioxide. Okay. Kidneys, they're more complicated. The lungs act really quick. The kidneys take longer to kick in, but they're very effective because they can do two things. Hydrogen ions. You know what they can do with those? You can get rid of them. Kind of a tacky term is pee them out. Or they can be resorbed. And that term resorbed means send them back into the bloodstream. So when would I need to hold on to hydrogen ions if I'm too what? Alkalotic. And so I'll need to resorb those and send them back into the bloodstream. If I'm too acidic, what are my kidneys going to do? Get rid of them. But guess what else your kidneys can do? That bicarbonate, that HCO3, that is a base. And so your kidneys can do the same thing with that. They can make more. They can make some other systems make bicarbonate too, and we can hold on to it. When would we need to hold on or keep more bicarbonate in our body if we're too what? Acidic. Or if we're too basic, then their kidneys can help us get rid of bicarbonate, which is a base. See what we're doing? We're balancing those acids and bases with carbonic acid, CO2, and bicarbonate. Are y'all following that so far? Okay. What's our first line of defense? Sulfurs, right. And what's that system? What two things are in that bicarbonate, carbonic acid buffer system I just told you? So what's the ratio? 20 what? 20 bicarbonate ions to 1. And that, you know how we know that we have that? What value are we going to go back and look at? Your pH. And what is normal pH? That's how you know if you've got acid-base balance. You look back at that pH. Okay? And then, who's the second line of defense? Okay. When will the lungs need to hypoventilate or breathe slower? When will they need to do that? When the CO2 is low. Why do you say that? We've got to hold on to it. We need it. And when do my lungs need to breathe fast and deep? When I've got too much. And what am I doing? Blowing it off. Okay? These are normal things. Okay? All right, let's talk about the kidneys. They're more complex. What can they do to help us maintain acid-base balance? What can they do with hydrogen if I'm too acidic? If I'm too acidic, what are my kidneys going to do with that excess hydrogen?
Get rid of it.
Get rid of it. How do we get rid of it? Get out. Okay, good. What if I'm too alkalotic or basic? What can the kidneys do? They can get rid of bicarb, which is a base, and they can hold on to hydrogen, which is an acid. So they're more complex. They take a little bit longer to work, but they're very effective. Okay, those are the three things. Okay. Uh-oh. What if I'm in kidney failure and on dialysis? Are my kidneys going to do what they're supposed to do? No. We'll be talking about that, okay? Okay, all that was normal. That was normal stuff. Back to the pH, 7.35 to 7.45, that narrow range. Y'all, if your pH gets down to 6.9, would I be acidic or basic? eat up with acidic. If you get below 6.9 or above 7.8, what do you think might happen to you? Yeah, that's incompatible with life, okay? Now here's where people might get a little bit confused, okay? So all that was normal. But now I'm thinking about if the lungs can't do their job sometimes, or if the kidneys can't do their job sometimes. We have this thing called compensation. Or another way to look at it is their friend is helping out. They're going to help them compensate because they're not doing a really good job for whatever reason. So let's look. The lungs, they're going to compensate for the other system, which is the metabolic system of the kidneys. Now here's what's really important to think about. The lungs, what kind of acid can they get rid of? Carbonic. What other kind? That's it. So how can they help the kidneys?
Either hyperventilating or hypo.
Yes. They're going to hypo or hypoventilate, and they're going to get rid of more carbon dioxide. They're not getting rid of metabolic acids. They can't. But they're going to get rid of a way more CO2 or carbonic acid, and what's going to be the end result of that is it's going to help normalize the pH. So if I looked at a blood gas report, which we'll be looking at in a second, and my lungs were compensating for too much metabolic acid, I would see the CO2 go really low because we'd be blowing off that CO2. So, and we'll talk about that more in depth, but I just want you to know that the lungs help the kidneys, but they never get rid of metabolic acids, just their kind. But by them getting rid of or holding on to more of their kind of acid, it helps normalize the pH. Okay, because we don't want that pH to get out of whack because bad things happen. Okay? And this happens really, really fast. An example of this would be like, if I want to go run a marathon, and what kind of acid is probably going to build up in? Probably lactic acid. And maybe my kidneys just can't keep up and get rid of all of that. So what do you think I'm going to be doing? What am I doing? I'm blowing off CO2. And what's that going to do? Am I getting rid of lactic acid? No. I'm getting rid of extra CO2, and it's going to help balance out that pH. Okay? The lungs are going to be working like the devil, trying to keep me from getting in a terrible state of acidosis. Okay? Does that make sense? How the lungs, you start breathing fast to help the kidneys out. Really, you're just blowing off more CO2. So the kidneys can help the lungs. So can they get rid of carbonic acid? No. But what kind of acid what they can do? They can do a lot of things. Hold on to get rid of hydrogen, or hold on or get rid of bicarbonate. So you know when the lungs might not work like they should? Y'all had it in lecture last week. People who have poor gas exchange, like people with chronic bronchitis, that mucus and all that crap is built up in their lungs, can they exchange gas like they should? No. So what are they going to do? They're going to be holding on to CO2, aren't they? And so the kidneys will say, well, let me help out, friend. I can't get rid of CO2, but what I can do is hold on to some more bicarbonate and get rid of some hydrogen. And that's going to help balance out the pH. We're always worried about balancing out that pH, which is normal is what?
7.35 to 7.45.
Good. Okay. So this is compensation. It's a friend helping out a friend. Okay? Kidneys can't get rid of extra carbon dioxide. Lungs can't get rid of metabolic acids, but they get rid of their own kind or hold on to their own kind of acid, trying to maintain that pH if the other system is failing. Okay. Are y'all all right? Kinda? Boring slide, but I would learn this slide. Okay? These two right here, the first two, are what happens in a normal, everyday situation when your lungs are healthy, happy, and doing what they're supposed to do. Increased PaCO2, decreased pH. What kind of state is this? Acidic or basic? Yes, acidic. When you have decreased pH, that's acidic, okay? So, I'm acidic. What are the lungs going to do? Because I got too much of that, which is an acid. What are they going to do? Breathe faster and deeper and blow it off. Blow off that CO2. This is normal. Not enough, your pH is high. What's that word for high pH? Alkalosis. They're going to say, ooh, let's hold on. Let's breathe slower and hold on to that CO2. The top two are normal. Okay, that's what happens normal. The bottom two you see here, these are compensation, when the lungs compensate. So let's look. You've got a low pH, which means you're acidic, because you've got, let's just say we've got too much lactic acid, okay? The kidneys aren't doing what they need to do, so who comes to help? And what do? What kind of acid are they blowing off? CO2. They're not blowing off lactic acid, are they? And that's going to help correct the pH, okay? When we say correction, we're talking about the pH here. Increased pH, alkalosis, not enough metabolic acid. The lungs say, I know you don't have enough metabolic acid. Let me hold on to some CO2 and make you a little bit more acidic and see if we can get that pH corrected for you there. Okay? That's the respiratory normal response and compensatory response right there on that slide. Study that slide. Here's the kidneys. Oh, they're a little bit more complicated, aren't they? Same thing though. The top two are what happens in normal situations. You're acidic from too much metabolic acid, and so the kidneys are going to say, all right, I'm going to secrete more into the renal tubules, and what that means is you put it into the renal tubules to pee it out, okay? And make more ammonia, because ammonia binds hydrogen, and you pee it out, okay? So we're getting rid of it to correct that pH. Increased pH means that you're alkalotic, right? So I'm going to hold on to some hydrogen, and I'm going to get rid of some of this. Why would I want to get rid of that? What is it? It's the base. So if I'm too alkalotic, I need to get rid of base, don't I? So that's normal. And this is compensatory. The lungs can't do their job. Decreased pH. What have I got? A state of, I'm too acidic, right? So the kidneys are going to say, all right, lungs, let me help you out. I'm going to get rid of some hydrogen because you're too acidic, and hydrogen's acidic. Make more ammonia, get rid of it. Increase pH, I'm too what? Basic. So I'm gonna hold on to some hydrogen, because if you're basic, you need acid, right? And if I'm too basic, I'm gonna pee out some bicarbonate. You see, we're always teeter-tottering, trying to maintain that balance. And how am I gonna know if all this is effective? The pH. We're going to look back at the pH. That's the end result of acid-base balance. All right, so Sheldon has got a question for you guys here. So you've got a patient with a deficit of carbonic acid. So deficit, I would highlight that, means what? Too much or not enough? They have not enough carbonic acid. Is carbonic acid an acid or a base? It's an acid. So if they have a deficit of this acid, what do they need? What do they need if they have a deficit of acid? We need some, don't we? That means we're too basic. So half of the patient's body could be saved. So when we say the word compensate, what are we talking about? We're talking about the kidneys, the friend that's going to help out because the lungs aren't doing their job. So let's see. Would the lungs increase the rate and depth of respiration by hyperventilating? Tell me, you say no, but why? So if I hyperventilate, is that going to make that worse? Because my carbonic acid's low. So let's cross that one out, and don't you dare go back to it. Do y'all ever change your answer?
Yes.
Don't go. Once you cross it out, it's game over. We're crossing this out. All right, what about our pH? Would it decrease to less than 7.35? Well, let's think it through. But listen, if I have a deficit of carbonic acid, I'm too what? Basic. So what's my pH going to be? Low or high? High. So can we cross that out? Because that's the low end. That's acidic, right? Cross that out. Don't go back to it. Okay. The bicarbonate buffer system will take up excess acid. Well, do I have excess acid?
No.
Cross that one out. Who's the friend that's going to help? These. They're going to decrease how much metabolic acid they're going to get rid of. Why? Because we have a deficit. So we need some acid. So when you get these questions, look at the question and say, okay, they're either acidic or they're basic. One or the other. What do they need more of? If I'm basic, what do I need more of? Acid. If I'm acid, what do I need more of? Which one here gives you the answer to not enough acid? That one right there. So just break it down and think it through. Woo, Lord. Okay. Now, what time is it? We're going to take a break. But before we do, we're going to do these abnormalities all together. Okay? But y'all might hate me by the end of the day, but we're going to review a little bit. So if I have lots of hydrogen ions, what is my pH going to be? This or this? Low. Very good. And when my pH is low, what am I? In a acidic or a state of acidosis. Very good. Okay. What's normal pH?
7.35 to 7.45.
Very good. Okay. What are the two components of that buffer system we're talking about? Bicarbonate, which is HCO3, and CO2. Which one's the acid part of that? Which one's the base? What ratio do we need? 20 watts
20 bicarbonate
to 1. And if we have that, then we're going to have a normal what? pH. Very good. And these are working all the time. So if I don't have enough acid, I need more, right? Okay, so that's how that balancing system works. Who comes in second? The lungs, okay? I am too much CO2, too much. What are my lungs? My brain's going to tell my lungs to do what? Hyperventilate or breathe faster and deeper. And what is happening when I do that? Blowing off CO2, okay? Very good. On the other hand, if my CO2 is super, super, super low, what are my lungs going to do? They know I do two things.
Breathe slow.
Hypoventilate. And when I hypoventilate, what's happening? Holding on to CO2. Who's our third person? Who acts faster, the lungs or the kidneys? Lungs. Okay. Now, here come the kidneys. They're slower. They're more complex. So, say I have lots and lots of metabolic acids. Too much. What can my kidneys do? They can do a couple of things. What can they do? too much acid. Think to yourself, if I've got too much acid, what do I need to have happening here?
More bases.
I need either more base, or I need to get rid of some acid. Your lungs can do, I mean, kidneys can do all that, okay? So just think it through like that. And if my lungs can't work like they should, I've got COPD, my lungs are full of junk, who's gonna compensate or help? Can they get rid of carbonic acid or CO2?
No.
No. Well, then how can they help? What's the deal? What do?
Get rid of metabolic acid.
They get rid of their kind of acid. They get rid of metabolic acid. Is that going to make my CO2 level change? Not
No, it
really.
balances the pH.
Say it again.
Balances the pH.
It's going to balance the pH. Perfect. Is all that kind of making sense? Okay, take a break and we'll dive into the disorders, okay? Let me tell y'all when to come back. We've only got 4 disorders to talk about. Metabolic and respiratory acidosis and alkalosis, okay? And really these aren't diseases, they're the result of something else going on in the body, what we're about to talk about. So let's look and see. All right, so there's a lot of mess on this slide, but this is everything about respiratory acidosis on this slide, and I do recommend the concept map. So here's the first thing that I would get in my head. If it's respiratory acidosis or respiratory alkalosis, who is the problem? The lungs. Don't forget that. People miss that on the test all the time. The person's in respiratory acidosis. What system is causing the problem? It's the lungs. If it's named respiratory acidosis or respiratory alkalosis, the lungs are guilty as sin. And what are they doing in respiratory acidosis? Look, the cause, y'all say this, the cause of respiratory acidosis is hypoventilation. Because what am I holding on to? And if you have a lot of CO2, what are you? Acidic, respiratory acidosis. So let's see what could cause that. And y'all need to know this word right here. So if you have a high PaCO2, which is the arterial concentration of carbon dioxide, we call that hypercapnia. That means too much. It's fancy. You don't have to have a fancy word for it. Hypercapnia. So either you're not breathing fast enough, or there's some kind of problem causing you not to have good gas exchange. So what could cause that? Look at here. COPD. Do you see anybody guilty here other than the lungs? COPD, pulmonary edema. Do y'all know what that is? A lot of fluid in the alveoli, pneumonia. You're having bronchospasms. All of these things can cause you to have. Y'all, people with COPD are very prone to respiratory acidosis. What does this mean? Underventilation by mechanical ventilation. That's a ventilator. Yeah, that's a ventilator. And so they have settings on the ventilator. So I can turn your respiratory rate to 30 if I want to, 12, 10. I mean, I'm controlling your breathing if you're sedated and all that stuff. What if I turned your ventilator setting down to 4 and you were only breathing 4 times a minute? Is that okay? What are you going to be doing? Holding on to, what's another word for that? Hypercapnia. Very good. Okay. What else can cause you to hyperventilate? Like if you had somebody that was laying in the bed flat on their back and they were very obese, like very obese. Could they take good deep breaths? No. So what might I do? Yeah. Okay. Oh, pain. Well, we're going to talk about pain in 2 different ways. But what if I had just had my chest cut open because I had a cabbage, coronary artery bypass graft? Do you think I'm going to want to take really nice deep breaths? Because when it hurts, I'm going to be going,
Hold on to that hot pillow.
I'm going to try not to take deep breaths, hold on to the pillow. So I'm going to hold on to CO2. Do y'all remember Miss Cooper showing you that abdominal binder for wounds, that stretchy thing? Well, what if I come in there and I put your abdominal binder on it and I rear back and I put that thing across you so tight you can't hardly move. I'm keeping your belly from popping open, but what else am I keeping you from? Taking deep breaths. Okay, so even an abdominal binder can do that. So that's why we check our patient's respiratory rate. And y'all, everybody ain't breathing 16. You gotta really count it, okay? And then non-pulmonary things. So what if I come in there and you're in pain, you had your leg amputated today, and you need some pain medicine. And maybe I didn't check your vital signs or something, and my friend had already medicated you with morphine a little while ago, and I'm tearing in there really early and giving it to you again, and you were already breathing 6 times a minute, and now I give you 4 or 5 of morphine IV, and now suddenly you're breathing not at all, or 2 times a minute. So I can snocker you out with opioids. Right? You can become so snockered that you are in respiratory acidosis. Does that make sense? I can knock it out. I can do that as a nurse to you. Or surgery, anything like that. And then, remember I said that, your brain has to tell your lungs what to do. Well, if my brain's not working like it should, it can't tell my lungs what to do. So a neuro disorder could cause me to have respiratory acidosis and hypoventilate. Does all that make sense to you? So do you need to know for the test, hypoventilation causes respiratory acidosis? Yes. But then do you need to know some of the conditions that cause you to hypoventilate? You do. So if you're hypoventilating, what's my PaCO2 going to be, high or low? I'm hypoventilating. Yeah, because I'm holding on to it. I'm loving that CO2. Just holding on to it. So what is my patient going to look like? Let's look over here. We talked about hypercapnia. If they're not getting good gas exchange early on, they'll be anxious and restless. Does that make sense? What Dr. Wright say the first sign of some kind of respiratory compromise is?
Anxiety.
They're restless. The restlessness and squirminess and squirreliness, which isn't even a word, could be that they've got some respiratory stuff going on. They start to get anxious and nervous and restless. That's usually the first thing that happens. Headache. When people have elevated CO2, they vasodilate, and they can have a headache. Lethargy, shortness. Tachypnea means breathing fast, okay? Well, you just said hypoventilation causes it. Tachypnea could cause it if it was somebody that had asthma and they were going, they were breathing really, really fast, but not deep. They could still hold on to CO2. And here's a really important thing that you should write down and never, ever, never, ever, ever forget. Acidosis, and this was on your last patho test, y'all, I saw it. Hyperkalemia goes along with acidosis. What electrolyte is that? Okay. So, who's guilty? Who's guilty? So who's going to help? And what are they going to do? I've got too much acid, so what are they going to do? Get rid of hydrogen and maybe hold on to some bicarb. And then I've got to treat the problem. So if my abdominal binder was too tight, loosen it. If my ventilator settings are off, fix them. If I'm snockered with an opioid, naloxone or Narcan, if I've got too much crap in my lungs, mucolytics, medication for infection, I treat the cause of the problem, okay? Bronchodilators, that kind of thing, okay? I love this slide with all my heart because it shows you why you get hyperkalemia and acidosis. So this is a cell, and the cell says, you know what? I know that you're in a state of acidosis. So I'm going to try to get some of that hydrogen out of the bloodstream. Because remember, the cells try to help out too. So they're going to say, we're going to take some of this hydrogen in because you're too acidic. But do you see hydrogen has a positive charge and so does potassium? So when the cell pulls that hydrogen in, what does it kick out? Potassium. Where does it kick it out into? The bloodstream, hyperkalemia. The cells try to help out, take in that hydrogen, and they kick the potassium out into the bloodstream. Yeah, so what are we worried about with a potassium imbalance? First and foremost, what system? Cardiac. We're worried sick about cardiac with hyper and hypokalemia, right? And muscle, okay? So that was respiratory acidosis. So let's look at metabolic. Who's guilty? It's titled metabolic acidosis. Who can't get rid of? The kidneys, okay? Let's see what maybe could cause that. We already talked about DKA, and I don't really know about that because we haven't done diabetes. But in the absence of insulin, you know, your body can't use glucose, so it starts to break down fat, and which creates these things called ketones. What you just need to know is those are acidic, okay? So diabetic ketoacidosis, starvation, these things can cause metabolic acidosis. Kidney disease, if your kidneys if they're not functioning, they're not able to get rid of acids, okay? And so these people are very prone to metabolic acidosis.
So like
Dialysis patients, yes, absolutely. Yes, are you stretching or just stretching? Okay. If I decide to drink antifreeze, which is a horrible idea, I did take care of a patient one time that had drank a bunch of Drano. So, I mean, they did it on purpose. But that would be a cause for acidosis, right? Or too much aspirin. Or maybe, just maybe, I'm getting rid of too much base that could cause me to be in acidosis because your intestines are a very rich reservoir for bicarbonate. And if I have diarrhea, I'm getting rid of all my bicarb, right, which is a base. And so if I'm getting rid of too much base, I'm going to be too acidic, right? And so how you remember that is a little off color is this. So if you have diarrhea, it comes out of, and so you get acidosis, okay? Because you're getting rid of too much base, okay? So either in metabolic acidosis, you've got too much acid you can't get rid of, or you got rid of all your base. One of those things. So the signs and symptoms are pretty much, for acidosis, they're the same, pretty much, metabolic and respiratory. Headache, drowsiness, they could be in respiratory distress, hyperkalemia, they could have hypotension. So who's going to compensate? So if I'm too acidic, and I hate it's already up here, but if I'm too acidic, what are my lungs going to do? And what are they doing when they hyperventilate? Blowing off what? And why does that help? It gets rid of more of their type of acid, and it helps to correct the pH.
Whatever it says fistula's, like,
What a fistula is, and I wouldn't stress on that too much. A fistula is a connection between two body parts that shouldn't be there.
dialysis sports, got it.
So, well, dialysis part, or you could have a tracheal, bronchial fistula, is where two body parts connect. So, I wouldn't dwell on that one too much. All right, so those were the acidoses. Okay, now the alkalosis part, which is what? What's your pH if you're alkalotic? High. Very good. So, who's going to be guilty if it's respiratory alkalosis? Yeah. Caused by hyperventilation. I'm breathing too fast. I'm blowing off all my CO2, right? So I'm alkalotic. What could cause that? This is hypocapnia, by the way. Lung diseases. So I know you saw that some of these were the same, for acidosis and alkalosis. It just depends on the patient presentation, but if I'm breathing too fast and I'm breathing deep enough to blow off all my CO2, then this can happen. This stands for respiratory rate, y'all. Because what's normal respiratory rate? 12 to 20. So I'm breathing too fast here. In this case, somebody turned my ventilator setting up to maybe 28. So I'm breathing too fast. Acute pain. So we talked about pain might make me not take a deep breath. But could pain also, like if I just got my leg cut off like right this second, would I probably start breathing fast? I would. So that can cause it too. You have to look at your patient's clinical presentation. Ooh, y'all. Anxiety. Prolonged sobbing. Have y'all had that yet? You might have put yourself into respiratory alkalosis. So what could you do if you were prolonged sobbing and so nervous? What does your friend say? Here. They might say drink some water, but they may say here, breathe into this bag. Breathe into this paper bag. Why? You're breathing back in that CO2. You're breathing in that bag. Okay? You could have a tumor that's causing you to not, your brainstem controls your vital signs. And so if your brainstem of your brain is damaged, then you may not have that drive to breathe. All right? Or you may have too much drive to breathe, either way. Okay? Clinical manifestations of this: hypocapnia, low CO2. All of these signs right here are from not enough calcium. And now we've got hypokalemia. So did y'all didn't talk about calcium with electrolytes. Okay. In the presence of alkalosis, calcium binds to albumin, and it's not in the bloodstream like it should be, and we need calcium. So some of the signs of hypocalcemia are Trousseau's and Bostic signs. Did y'all talk about those? No. Okay. So Bostic, and I think I've got it. Let me see if I've got it on this next slide. Yeah. Y'all just look at this right here. This is how you say Bostic. It's not Shabbat stick or anything like that. It's Bostic sign. And so what you do to elicit that sign is you just kind of tap on the person's cheek like this, and they crinkle up their face. Okay, that's Bostic sign, and it's hypocalcemia. Trousseau sign is where you put a blood pressure cuff on somebody's arm and you inflate it, You let it sit there for a bit and their arm will start to twitch. So y'all would need to know those, okay? So back to respiratory alkalosis. In alkalosis, there would be cerebral vasoconstriction, which would decrease the blood flow to the brain. So let's see, we already know what can cause it. This is all breathing stuff, isn't it? Breathing stuff, okay? We talked about the clinical manifestations. And who's going to help? If it's respiratory, who's going to help? Okay? I'm alkalotic. What do I need more of? Acid. And I need to get rid of more base, right? So what's the treatment? This isn't a disease. It's a reason that, so because of the pain, because of the anxiety and the prolonged sobbing and the ventilator settings, I need to fix the cause of the problem. Okay? So in alkalosis, I love this slide too, because if you just memorize this, you've got it. Alkalosis. K is potassium, your K is low. Alkalosis. You have a low potassium, and it's the opposite thing. Your cells are going to kick out some hydrogen to try to help that become more acidic because you're alkalotic. And potassium is going to now go into the cell and cause alkalosis. Your potassium is low, hypokalemia. Got it? Okay, last one. And then we're going to learn how to do some of these problems. Who's guilty? All right. So these things are either, so what we got? Alkalosis, you've either got too much base or not enough acid. Something's causing this. Too much base or not enough acid. Now let's look here. Not enough acid. What does emesis mean? Vomiting. Okay? So where does a really strong acid live? In your stomach. Hydrochloric acid. So if you're vomiting up your toenails, or if I put an NG tube down you and connect it to suction and I suck all your stomach contents out, and it's green or yellow or whatever color, usually green, and I've put an NG tube down somebody before and filled up that whole container like at the top of the bed. Could they go in alkalosis because of that? Because I sucked it all out. So, decreased kidney excretion, we talked about hypokalemia. I wouldn't worry too much about these endocrine type problems, but they interfere with getting rid of these acids. Holding on to these acids. So increased base. What does OTC mean?
Over the counter.
Over the counter. So if I'm just pounding Toms and Rolaids all the time, just living on all that mess, it could happen, okay? Because that would be too much base. Or what's a transfusion? So I'm talking about a massive blood transfusion, like unit after unit. Somebody in a trauma, it's got citrate in it, which is something that helps preserve the blood and helps it not to clot. And if they get all of this, too much of it, it can cause them to be alkalotic. A bicarbonate drip. We can give people a bicarbonate drip. We can push bicarbonate in a life or death type situation. Diuretics can cause it. So all of these things are causes of this disorder. Okay? Clinical manifestations of alkalosis, the same. You can have hypotension from either dehydration from vomiting. Have y'all ever vomited so much that you were dehydrated? Yeah. And then if you had both ends going. So hypotension or spasms, hypokalemia, hypocalcemia. Y'all just need to remember those things. And so who's going to kick in? So if I'm too alkalotic, what are they going to do? So I got to fix the problem. So if I'm pounding antacids, maybe I don't need to take so many antacids. If I'm vomiting, maybe I need an antiemetic, which is a medicine to stop vomiting. If I have an NG tube in and it's sucking out all my gastric contents, I still might need that NG tube. So we may have to do some kind of fluid replacement, or sometimes we do milliliter for milliliter replacement. But I've got to fix what's causing the problem. Okay. So what am I here? What is my pH? Low, okay? And who's guilty? All right, so let's look. Would my pH be greater than 7.4? Cross it out. Prolonged vomiting or gastric suctioning. What would that cause? Alkalosis, right? Because I'm sucking out all my acid. Let's cross that out. Metabolic acidosis, would my bicarbonate level be up?
No, that's basic.
Because bicarbonate is a base, isn't it? Cross it out. What's left? Yeah, so I might have CNS depression. Now let's learn how to figure out, when you get a lab, whether your patient is in acidosis or alkalosis, and whether it's respiratory or metabolic. Are y'all ready? Take good notes. Now, I said I'm getting this from arterial blood. It's called an arterial blood gas, or in the hospital you hear it called ABG, arterial blood gases. So, in this slide right here, the person is sticking a needle into the radial artery. Somebody has an arterial line, like in ICU, you can draw it out of there. You can draw it, it's drawn out of an artery, okay? That hurts right there, y'all, by the way. I'd rather have an A line. All right, so that's an ABG. Okay. Let's learn these normals. You already know pH has been beat in your head, right? If it's 7.3, am I acidic or basic? Very good. What about my hydrogen ion content? A lot or a little bit? A lot. Okay. Now let's look at the respiratory parameter, PaCO2. Well, I shouldn't have told you that. This tells me how effective which system is. The lungs. Okay. Remember I said that there's a weak an acid and a base in these systems here. This is the acid and this is the base. Okay. You need to know this. 35 to 45 millimeters of mercury is normal PaCO2. So if my PaCO2 was 55, what's the term for that? Hypercapnia. Hypercapnia. And would that mean I was acidic on that or basic? If it was 55. Acidic. Okay. What's this? Bicarbonate. Look, different books are going to have different numbers. They may be 1 or 2 off. Different hospitals may have different numbers. This is our number. 22 to 26 milliequivalents per liter. That's your normal. Okay. Now what is that? That is what we're going to use as our absolute normal when we start to figure out these ABGs. That's our absolute normal. We're going to use that one time and one time only. And I'll tell you when we're going to use it. For each problem, we're going to use that one time. So let's look and see. Y'all got all these? You got to memorize them. Okay. To help you keep this straight in your mind, because it's kind of hard to think about, this is kind of looks like a little marching band out suit, okay? So pH, if it's 7.35 to 7.45 is normal, we're going to say A is on this end and B is on that end. What does A and B mean? Acidic and basic or alkali. Lungs, PaCO2. If it's low, this is the acid, right? If it's low, it's basic. If it's high, kidneys, bicarbonate. If it's low, if the base is low, it's acidic. See how confusing that can be? Memorize this. A, B, A, B, A, B. When we start to figure out these numbers, okay? So a whole lot of bicarbonate is what? Because that's the base. That makes sense? So write down that little marching band thing when you get your paper. All right, we're about to learn how to do this stuff. Okay. Remember that absolute normal I said? What was it?
7.9.
We're going to use it, 7.4. We're going to use it one time for each problem. We're going to say 7.4 and below is acidosis, and anything above that is alkalosis. Okay? We're going to use it one time. So, for this problem right here, y'all, and Mr. Shergill and I were talking about this a while ago. I don't care how good you get at this. I don't care how sassy you are. Write it out every single time so you don't miss it. He works in the ER. He was saying those ER physicians, every time they still get their pencil out and they write it out. Acid base. I don't know if they draw the marching band, but they know, okay? So if we were going to write something beside this pH, 7.52, would you think you would write alkalosis or acidosis there? Then write it. So we know that we've got an alkalosis situation going on, don't we? Y'all agree? Now, I would say right here, every single time, I want you to write respiratory. I want you to write respiratory right there. And what do you think I want you to write right here? Metabolic. Okay? Because we've got to figure out if this mess is respiratory or metabolic, don't we? So now let's look at this number. It's low. What would you call that? This is an acid right here. What would you call that? Alkalosis or acidosis? Remember that marching band? So I want you to write alkalosis right here. And then what about that? Nothing, right? Because it's what? Normal. So here's how we do this. So we wrote alkalosis and we wrote alkalosis, didn't we? So what you're going to do is circle alkalosis, and then you're going to find the other alkalosis, wherever it is, and circle it. So you want to circle the matching words, okay? Y'all circle both of the alkalosi? Okay. Then you want to match it. Boom. That's circled. And so what kind of alkalosis do we have, y'all? Got respiratory alkalosis. You see it? And look at else. What do you see? Do you see hyper or hypoventilation going on? Look at that PaCO2. What's normal? What's normal? 35 to 45. What can you see going on here with a PaCO2 of 30? I'm blowing off my CO2. Exactly. I'm hyperventilating. Can you see it? All right. So we know we've got respiratory acidosis. Now, let's see if the friend is helping. This is the friend right here, the uninvolved one, the other system. We're going to look at this number right here. Is he doing anything? The number's normal. Is he doing anything? No, he's not. In this situation, alkalosis, and this is a base, what do you think that should be? Low or high? We want it to be low, don't we? Because we've already got too much base. Look. So you know what we're going to call this? Uncompensated. The reason we say uncompensated is we're looking at the other system or the friend that's supposed to be helping out. If their value is in normal range, are they doing anything? No, they're not doing anything. In this situation, who's guilty? The lungs. And what are they doing? You're going to look at this number right here to tell me what they're doing. And we already know what causes alkalosis. Y'all, what causes alkalosis? Give me some examples of things that could cause you to hyperventilate. This is how the questions are going to be. Anxiety. Sobbing. Everybody loves that one. Alkalosis. Something that can make me just breathe fast. Halloween's coming. And you're watching, what's the most scary Halloween show? Huh? Nightmare on Elm Street? I don't know. I don't watch them, I'm scared. But if you were watching that, could you have hyperventilation? Looking at what? Looking at him? Y'all look at him. Okay. All right. So what do y'all think? Does that make sense? Let's do another one. And look, why did we say that? pH, we're using 7.4 one time. The only time we use 7.4 is to write this word right here. Okay? Let's look at another one. Okay. Write it out, y'all. Write it out. With your gloves, we walk it out. With ABGs, we write it out. We're doing something else. All right? What are we going to write right here? What are we writing right here? Every time. Okay. Now let's pull that 7.4 out. And what are we going to write right here? We're either going to write acidosis or alkalosis, using 7.4 as our absolute normal. What are we going to write right there? Acidosis. Okay? Okay, what do you think? What would we, this is an acid, it's low. We're going to write alkalosis here. This is our base. Okay. Now y'all look. Acidosis, because this is less than 7.4. Acidosis. Did I say alkalosis? Acidosis. We're calling this alkalosis because it's less than, what's normal? PaCO2? 35 to 45. This is an acid. A low acid makes me what? Look. Makes me what? Basic. So I'm going to write alkalosis. Now let's look at my base. It's low. Low base means what? See how that helps you? So circle the matching things, acidosis, and circle the other one. Go across. Who's guilty? Y'all, this is metabolic acidosis. Can y'all see that? Are y'all good with knowing that's metabolic acidosis? Can you? All right. Now, who do we need to look at to see if there's compensation going on? The lungs. Well, let's look. Something's happening. Something's happening. How do I know that? Because normal's 35 to 45. And this PaCO2 is 31. What are the lungs doing? They're compensating how? What are they doing? They're not holding on to it. They're getting rid of it. Because what's normal? 35 to 45. They're blowing it off. Okay? So, there is some compensation going on. Now, here comes the sticky wicket. Now, we're going to look back at the pH, y'all. We threw that 7.4 away. As soon as we wrote acidosis there, we threw it away. Now we're pulling back out our normal range of pH, which is what? 7.35 to 7.45. Is that within normal range? Is it? But are the lungs trying to help? Okay. I can see that the lungs are trying. And if I did another ABG in 15 or 20 minutes, that pH might be normal. I don't know, because the lungs work pretty fast, right? But right now, this is partially compensated metabolic acidosis. Why is there any compensation? Can you see? Why would you say there was some compensation going on? Because the friend's number is out of range. It's out of range. Because 35 to 45 is range. The reason I wrote alkalosis is what? Now, when we decide whether it's full compensation or partial, we look back at what? The pH. You always look back at the pH to determine how well you're doing here. Remember, the pH is it. And this is not right, is it? So it's partially compensated. Because the lungs are trying, they're doing something, but it hadn't happened yet. Full compensation has not happened yet. What's this metabolic acidosis? What could cause that? Metabolic acidosis. Give me some causes. I'm holding on to metabolic acids. Lactic acidosis, DKA, your favorite thing, diarrhea. Okay? That's the questions are going to be like that. Like you may see an ABG and you figure it out, and then we may say, well, what could be causing that? And give you a drop-down box of what might could be causing it. How are y'all feeling? Let's do another one. Y'all write everything out every time. Every time. Respiratory. Metabolic. If it helps you, this is an acid. This is a base. Okay. Pull that 7.4 out of your pocket, and let's look at that pH up there. What are we going to call that? What are we going to write beside that? Acidosis. Write it. Once you write that, you throw that 7.4 away. We're through it. Okay. PaCO2 is 29. What are we going to write beside that? Alkalosis. This is metabolic. It's 20. What are we going to write? Okay, this is a low base, right? Okay, so we wrote acidosis. We wrote acidosis, and we did that because we had our little marching band person over here, and we knew. So what kind of acidosis have we got? You see how we match them up to figure? Okay, we know we've got metabolic acidosis. Does everybody agree? All right, we're through with that. Now we got to look at compensation. Who are we going to look at? The respiratory system. What's normal? What's normal PaCO2? Is this normal? So that means some kind of compensation is happening, doesn't it? Okay, so let's look. If we want to know whether it's fully compensated or partially, we're going to look back at what? What about that pH? Do y'all like it? Do you love it? Do you want some more of it? Yes, that is fully compensated because those lungs came to the rescue and they did their job, and that pH is now normal and all the cells are happy, the potassium balance is good, everybody's happy, right? But look, what's interesting is neither one of these numbers here are within normal range, are they? They're working back and forth, kind of like a seesaw or Mr. Sherdell said they may not know what a seesaw is. Maybe they know what tug of war is, where you pull that rag back and forth. Okay? Same thing. There's got to be a checks and balance here, okay? Let me ask you this. What are the lungs doing to compensate? Look at it. What are they doing? Well, they can only do two things. So you got a 50-50 shot. What are they doing? They're blowing off CO2, and you do that by hyperventilating. Excellent. Every time, y'all. Respiratory. I don't care how monotonous it is. I do it every time. I've been teaching this 1,000 years. Metabolic. This is an acid. This is a base. You can write your little marching band. I draw that little marching band outfit on my scratch paper, so I didn't get in a mess. You know how you get scared on a test and you can't think straight. All right. Using 7.4 as an absolute normal, what are you going to write right here? Say it loud. Proud. Good. What are you going to write right here? Well, tell me what normal is. 35 to 45. This is 53. What you going to write? Acidosis. Good. What about here? Oh, okay.
Basic.
All right, let's circle our acidosi. Acidosis, go across. Who's guilty? Yes. What are the lungs doing to cause this behavior? Look at that PaCO2 and tell me what the lungs are doing. They're hypoventilating. They're holding on to CO2. What could cause me to hypoventilate, or you? COPD, extreme obesity. What? Too much pain medication. Me coming in there with all my might and tightening up your abdominal binder so you can't breathe. Okay? Now, we know this is respiratory acidosis. We know it. Who we're going to look at to see if they're helping? Are they? Oh my gosh, they're so lazy, they're doing nothing. Nothing. So, and then look at the pH. Is it normal? Uncompensated. Kidneys aren't doing anything. Here's the compensations you can have. Fully, partially, or un. Fully, partially, or none. If I'm fully compensated, what's my pH going to be? What is normal? Very good. If I'm partially, if in this case, we're going to say this was partially compensated, what would this number have to be? Yeah, you'd want it to be high, wouldn't you? Because if I'm acidic, I need more base. So I'd want that to be high. But if my pH was still bad, it'd be partial compensation, wouldn't it? Does this little marching band little thing help? I think it does, because it's hard to think about sometimes without it. I'm going to not say a word. And y'all figure this out. But write it. Write it out. I don't want you to miss it. Are y'all already to the point where you're sassy and you're doing it in your head? Don't get it. Don't get that way. How y'all doing? Do y'all know it had an answer? Still thinking about it? This might get kind of fun to you, maybe. And then you'll want every question to be this, huh? Find the pH value. We're gonna give you that.
Okay, we'll get
Yeah,
everything.
yeah.
I don't know if you're doing more math.
That's 7.4 absolute normal. You use that to write that acidosis calculus. I hear a lot of discussion. Who knows what this is? Who knows? What is it? Y'all listen, we got somebody that knows. Say it again. He says fully compensated respiratory alkalosis. Do y'all agree with him? Give him a hand. Woo! Did y'all all get that? Did y'all get it? Yes. Say it loud. No. If you've got that question, somebody else does.
I was just trying to see how you got the alkalosis because the pH was normal.
Okay. And everybody has that same question, and it's very common. Remember that 7.4 that I said we pull out of our pocket one time to write this word right here. So this 7.43 is high, based on that 7.4. So once you write alkalosis there, you throw that 7.4 in the garbage, and then you're going to start using that 7.35 to 7.45 range. Okay? Yes. Okay? Here's how we tell if it's full or partial. Y'all, somebody tell me. Well, who's guilty? What are the lungs doing? Hyper or hypoventilating? Hyper. Blowing off CO2. Because what's normal?
35 to 45.
Okay. Now the friend, are they helping? Yes. Because what's normal? 22 to 26. So it's helping. So here's how you tell. We know with this number not being normal, we got one of two things. We've either got full compensation or partial. If it's abnormal, the friend, there's two things going on, partial or full. How do we know? We look back at the pH. When you look back at the pH, is it in normal range? It worked. It worked. Thank you. Thank you to who? Thank you, kidneys. I was watching that scary show or sobbing, and you helped me out, so I didn't have a terrible outcome. Yes?
Can you explain why the respiratory system is either hyper or hypoventilating in this?
Okay. We have to think about the normal. What's normal? 35 to 45. So if this is low, I am blowing off or getting rid of my CO2 by hyperventilating. Does that make sense? And so if that number were super high, I would be holding on to my CO2, or either I have terrible gas exchange, like, secretions in my lungs or something like that. Very good. Okay, do that one. real systematic about it. Does anybody think they know? Coleman, you're smiling. Do you know? Okay. Don't smile. Yes, you know?
Yes, ma'am.
All right, y'all listen. Let's see if we've got a winner.
Uncompensated metabolic output.
What do y'all say? Let's see. Let's see the gender reveal. Give her a hand. Woo! Okay. We said alkalosis because we used 7.4 and it was above 7.4, so we all together wrote alkalosis. Then we looked at respiratory and we said, 35 to 45 is normal. What have the lungs done? Nothing. Okay, and then we look here, and this is high, right? High base is base. Alkalosis, metabolic. Oh, me, what could cause this? What could cause me to have metabolic alkalosis? Anything about breathing? No. Okay, rule that out. What could cause me to lose too much metabolic acid? NG2. Vomiting. Right? Could I be taking a lot of Tums? Okay. Anything with too much base. Now we've got to decide about compensation. So, really, is anything happening? We're going to have to give the lungs a U. Unsatisfactory, okay? Because they didn't do anything. What should they do to compensate for alkalosis? What should they do? Hyper or hypoventilate? What should they do? Hypoventilate, right? To hold on to CO2. It gets confusing, doesn't it? Write it down. Y'all, write it down, my word. Are you getting a little bit faster, a little bit more confident in yourself? I see some smiling faces back there on the back row. Back row. You got it, don't you? I see it. Are you ready to tell us? Yeah. What is it? Come on.
Fully compensated metabolic alkalosis.
What do y'all think? Very good. Very good. Any questions about how? Come in and tell them how you got that done. Do y'all have any questions about why it's fully compensated? What's the question? Yes.
So I'm confused how you know whenever it's fully compensated.
Partially? Okay. So we know by looking at this number right here that something's happening, don't we? Because it's out of range. Because range is 35 to 45. In fact, y'all tell me what's happening here. Hyper or hypoventilation? Hypo. Okay, so we know something's happening. To know whether it's full or partial, we're going to go back up to the gold standard, which is the pH. Is it within 7.35 to 7.45? Is it fully compensated? Because we've got a normal pH going on. You got a normal pH going on? It's either a normal blood gas or it's fully compensated. What I do recommend though, y'all, don't get so confident in yourself that you don't work any of these problems until next week, because it'll go away. Do something every day. Do something every day. Remind yourself. I got those concept maps. I got a couple of problems on them. What's too much CO2 called? What's the word? Hypercapnia. What's this? C word. And what is it testing for? What kind of calcium? Too much or too? Huh? What kind? Very good. Hypocalcemia. What's the other one? Trousseau. Put your blood pressure up on. I am acidotic. What's my potassium going to be? High or low? I am acidotic. What's your potassium going to be? High or low? It's going to be high. What's the word for that? Okay. What is normal potassium level? Yeah. Can't just memorize hyperkalemia and all that mess. You got to know what the value is. Okay, who knows this? Who knows this answer? Who does? Come on. What is the answer? She said partially compensated respiratory acidosis. Deal or no deal? Give her a hand. Very good. Okay. Who's guilty? What are they doing? Look here and you'll know. What are they doing? What kind of? Hypo. I just gave them 10 milligrams of morphine and they just had 5 milligrams 2 hours ago. They are knockers. Okay. Is anything happening with the friend? Yes. So we know that we've got partial or full going on, right? What do we look at to know for sure? The gold standard. So we're not normal, are we? So it's partial because they're trying. Who's trying? Yeah. When I'm watching the game Saturday, I might have respiratory alkalosis. Because what might I be doing? What kind of ventilating? Hyperventilating. Why might that be? I do not want Georgia to win. Who wants wants Georgia to win. Oh, man. Come write your name down right here. Roll Tide. Sorry about you, Aubrey. Who knows the answer? Yes, ma'am. What is it?
Partially compensated respiratory alkalosis.
She says partially compensated respiratory alkalosis. What do y'all think?
Yeah.
Y'all are getting this. Give her a hand. Don't leave anybody out. What's caused? Who's guilty? What are they doing? What are they doing? Hyperventilating. What could cause me to hyperventilate? The game. What else? I hope it's not prolonged sobbing from the game, right? Okay. Why do we say partial? Tell me why we say partial. I know you know now. Why do we say this is only partially compensated? This one's trying to compensate. This one's guilty. That one's trying to compensate. So it's partial because this is happening. Something's happening. So how do I know something's happening? Because 22 to 26 is normal. Here we go. Is that normal? It's getting close, isn't it? But it's close enough. Only in horseshoes. So we're going to call this partial. Y'all probably don't even know what horseshoes are, do you? A game? Okay. Who thinks they know? Who knows they know? What you got? What you got here? Fully compensated metabolic acidosis. What y'all think? Woo! What could cause me to have this terrible thing? Diarrhea. That's everybody's favorite. Okay. What else could cause me to have this? Who said that? Kidney failure. That's exactly right. Kidney failure. Yes. Mr. Sherdale is giving out some sheets of paper. So there are problems on here for you to work together. Y'all can talk and raise your hand if you have